Thank you, Dr. Hubbard. Great introduction. I will be presenting. I will be perspective on all of this topics. In the next few minutes, thank you, Dr. Hubbard. Great introduction. I will be presenting a patient's perspective on all of this topics. In the next few minutes, you're going, oh, I should actually tell you who I am. That's kind of important. I am the Patient Initiatives Director at Open Notes, the Open Notes Lab at Beth Israel Deaconess Medical Center. And in the next few minutes, you're going to learn a bit about my first person experience of growing up with access to my records in my portal. And then I'm going to share some evidence around how transparency increases trust between clinicians and patients. And then finally, in the third section, I'll talk about some application around how transparency principles can be applied to the immediate access to results as mandated by the CARES Act. Part one, my lived experience. In 2005, at age 25, I was introduced to my first online patient portal. I love this portal. After I could use the portal to pick a doctor, set up appointments, order prescription refills, all online. And as a healthy young person, this was so exciting to me because it meant I did not have to make any phone calls. And what I didn't know at this time is just 2 years prior, my health system became one of the largest customers of Epic. So I became one of the first massive patient users of something called MyChart, that is now called MyChart. 3 years later, I suffered a massive seizure at age 29, just right after my 29th birthday, and I landed in ED, and a scan showed I had a mass in my brain, and then after surgery, to remove that mass, I learned to have grade 2 astrocytoma. These days, I now know I also carry favorable biomarkers that say I have the IDH1 mutation. After that surgery, about 6 months later, that tumor recurred, and I had a second surgery. And then after that surgery, I faced 24 months of temozolomide, physical therapy, occupational therapy, speech therapy, all of the things. There's no right way to respond to a brain tumor diagnosis, but my immediate response was to lean in through curiosity. And after every appointment or test, I would faithfully log into this portal and stare at these metrics and graphs that were depicting various details about what was going on in my body. I love this thing. And there was information in that portal that I didn't quite understand. I went online and looked it up. This is 2008. This is not right now, but I would know to go on the internet and look things up. And if there was more questions that couldn't be found on the internet, I used the same portal to message my doctor to ask questions. Because what meaningful use is this information without interpretation? Fast forward a couple years later, spoiler alert, I'm still alive. My husband Brett, amazing husband Brett, was offered a great new job. And unfortunately, with this new job, I couldn't keep my same doctors and health system and health insurance. So I had to ask for a copy of my medical record from the last 8 years of living with a brain tumor. In that process, I did a full medical records request, which I found out that if I asked for a paper copy of my record, it would be $725. I was like, what could be so expensive? What's so important that it would cost that much money? So eventually I got a PDF copy of my record for $15 on a disc. And I was so curious, like, what's on this disc? I must see which costs so much money. And I stuck that disc into my computer and I found a 4,800-page PDF file. That was my prior 8 years living with a brain tumor. I opened it up, and in there I found some things I had seen before, such as emails back and forth with my doctor, memories, and things like my test results, things I had seen before. But the vast majority of my record were things like this: progress notes, the actual words my doctor was writing about me. I had never seen this information before. And quickly I learned that these notes, these things that were hidden from my view all of these years, were really important. They helped doctors and other healthcare professionals understand what was going on with my plan for treatment and my care. And I was so surprised that I could Google so much about my own health, but I could never see what my own doctors were writing about me. And I was inspired and surprised. And I was asking my other patient friends, can you guys see the same stuff too? Most had not. And I noticed that throughout the prior 8 years of living with this brain tumor, when I had questions and I wondered about things, there were these corresponding clarifications in my notes. In time, I became an advocate for transparency and having access to information. And when I would talk to clinicians and researchers about this topic, they would say, well, not all patients are like you. They can't understand. And by the way, I have no special training on any of this officially. But in asking around and learning more, I found out that there were some clinicians who were interested in this topic. And that's how I met my colleagues on the Open Notes team at Beth Israel Deaconess Medical Center who were studying this concept. In 2017, I joined that team at Open Notes. We're at Beth Israel Deaconess Medical Center. Open Notes, think of us like a lab with real PIs who are rock stars who know so much more than me. And we started to think about ourselves around this time as like a movement founded in research, where we've been encouraging clinicians and other healthcare professionals to share the notes that they're writing with their patients that they're caring for. We're clinicians, we're social scientists, we're mental health experts, and then we have one patient advocate. And we've really, over the years, been studying and disseminating best practices on how to live in this world of transparency, of access to everything in the records. It's important to know that Open Notes is not a technology. There's no app. It's an idea of sharing. And the concept of an open note, lowercase, is when patients can read and easily access their progress notes. Since the first Open Notes study was published in 2012 in the Annals of Internal Medicine to, like in the last couple of years, we had about 120 published studies on this concept in various journals. And what we started to see again and again, the theme, the trend around the notes, and I'm not talking yet about test results, but the notes themselves, patients who read their notes when they had access, because not every health system was doing this for many years, but they felt overall more engaged in their care. And we talk about patient engagement all the time. Engagement, engagement, engagement. Patients need to be engaged. I'll tell you what, there's not a single person more engaged in their care than the patient and the family. So patient engagement, we get it. And we felt more engaged when we had access to our notes. And we also, when we had the notes, could remember the visit more. And mutual trust started to develop between doctors and patients who were operating these Open Notes environments, because patients were reading those notes and asking more informed questions after the fact. And interestingly, caregivers were saying from studies of caregivers who were reading these notes after the visits as well, felt like they better understood the situation. Fast forwarding, by 2020, more than 260 health systems around the United States were proactively offering access to notes at more than about 15% of the US population. It's about 260 organizations. This was pre-Cures rule. It was not a mandate. These were health systems who read the research and studies and recognized that patients could benefit if they had access to their own health information. But something happened in 2021 that kind of changed things. The 21st Century Cures Act, it's called the Information Blocking Rule. I feel like it should be rebranded as the Information Sharing Rule. Dr. Hubbard just went over that, but really it was transformative. It empowered Americans, people who get care in the US, with access to everything in their records, without charge, without delay, immediately. That really changed things. Now, as part of the Open Notes team, the Open Noters, the folks who've been advocating for this and working with 260 health systems who were implementing Open Notes, we were like, what? This is amazing. Like, should we hang a mission accomplished banner and just say, I guess we're done here? But no. Part 3, applying transparency principles in a world where immediate access to everything in a person's health record exists. I'm taking us back a second before I get to test results. One of the things we noticed about over the last 20 years is there's this concept that I've heard about after the fact, is there's this concept of big amnesia after a clinical visit. Around 40 to 80% of what is talked about between a clinician and a patient in an in-person visit is misremembered or forgotten by patients or their family members. And I was thinking about that. I was like, yeah, I often forget most of what happens in my visits myself. But this idea of the big amnesia and what you forgot actually gets even worse when somebody's receiving information that's stressful. It's bad news, such as a cancer diagnosis or a change in a diagnosis, when the information is complex or when there's language barriers. And when I heard about that, I was like, yeah, this is the type of thing that when patients have access to the notes, that they can go back and read them and review them, that helps in that situation. Dr. Hubbard talked about a study that we published right before the Cures Act went into effect about the concept of the difference between clinician-patient views in open oncology notes. And surprisingly, or not so surprisingly, 98% of people with cancer who had experience reading their own notes at these health systems for the prior year believe that access to the notes is a good idea. Meanwhile, about 70% of their clinicians thought the same. So soon after the Cures Rule went into effect, we Open Noters were like, okay, mission accomplished. I guess this is now the law, and I guess we don't need to do more work. Everything is open now. Good, yay, I guess we won, I don't know. But within months, immediately started hearing from like the general clinician community that this Open Notes thing that we didn't like for the last 10 years, we love it. Open Notes are great. Well, love the Open Notes. You know what the real bad guy is here is test results. It's not the note. The note is written after the fact, after we've already talked with the patient. The note is great. Test results, that's the enemy. So we wanted to do, what researchers do is to just ask questions. And we wanted to know, is it true? Do patients even want to see this information? Do we want our test results immediately? Won't immediate test results make patients more worried? And what if a doctor hasn't even seen that test result? And what if that test result is abnormal, sensitive, and seriously, what if it's cancer? So we did a study, because that's what researchers do. They ask questions. So curious out of this room, raise a hand raised. I'm going to ask this question. What % of patients want to see their test results immediately? Okay. How many of you think it's around 25%? Okay. How many of you think about 50% of patients want to see their test results immediately? Okay. How many of you think it's 75% of patients want to see their test results immediately? How many of you think it's 100% of patients? Everybody wants to see their test results immediately. The answer is 96% of patients from this study, which I'm going to talk about in a second, said they wanted to see their test results immediately. And this is in a general population. It is not cancer specific, and that's the flaw here and why this needs to be further studied. But let's dig into this. We did a 4-site study, UC Davis, University of Colorado, UT Southwestern, and Vanderbilt. 4-site study across the country about this. We invited 43,000 MyChart users to participate in the study. We got a 19% response rate, and more than 8,000 people fully completed the survey about their views around accessing their tests. What types of tests were received? They could check boxes of more than one test that they received. Most people received blood results, some imaging and biopsy, COVID, et cetera. And we asked these individuals, and these are patient users of the portal, to tell us, think about your last test. What was the purpose of it? Most of them, it was an existing health condition they're getting information on to monitor that condition in some way. Others, regular screening and looking into new symptoms. And we asked patients, what do you do once you get this information while you're, and this is the time, we're thinking about the time between you get your result and before you see your doctor, you get a response in the portal. Like, what do you do with this information? And 40%, and Dr. Hubbard talked about this a little bit earlier, but 40% said they go do an internet search. Others talk about it with other healthcare providers, family members, friends, and 1% said that they go to social media to ask questions. Importantly, though, we started to notice of this study, 8% of participants and respondents said that they experienced more worry as a result of seeing their test result without clinician interpretation. So let's break that down a bit more. What we see in this graph is stratification of those from I was never worried to much more worried. And the dark blue box says these are people who received normal tests, and then the gray box are these people who say they received abnormal test results or not normal. So we're going to dig in. What's going on with the folks who are worried? So the folks, 70% of people with abnormal results said that they were more worried or much more worried as a result of seeing their tests. 17%. Meanwhile, people who received abnormal results said that they felt less worried as a result of being able to see it immediately. That's interesting. So of people receiving these results, overall, 96% still want to receive them immediately, even without clinician interpretation. Some people worried less, some worried more. What can we do? How might we do better for these patients, those in the worried category? Because we don't need to worry about everyone else. How do we deal with the worry? I think I'm getting close on time. So if you guys want to know my ultimate response or my personal opinion on, I'll get there. But finally, I'll say, what is the answer here? The answer here is the 21st Century Cures Act is not going away. Patients have immediate access to their information. And what you could offer clinicians is some anticipatory guidance. And we write about this in our paper in the ASCO book chapter. But word for word, this is what I offer for clinicians to use, as you can just tell us, I am ordering a test. You might see that result before me. And you, patient, have a choice. You can look immediately, or you can wait to hear from me. What questions do you have? Leaving it with a couple of takeaways from what I just said, so you remember. Transparency increases trust between clinicians and patients. Patients want to see our information, and you can offer anticipatory guidance when ordering tests. I'm Liz Salmi. Thank you for listening.